Hello, my dear students. Good day and best of luck. We shall start this course on the musculoskeletal system of lower limb. This is a bony pelvis. It is formed of three bones, one hip bone on each side and a sacrum in between posteriorly. The hip bone on each side articulates with the side of the sacrum at number 1, which is the sacroiliac joint, and it is a synovial joint. The two hip bones articulate together in front at the symphysis pubis, which is a cartilaginous joint. It is number 2. Note on each side, on the lateral surface of each hip bone, there is a black rounded area for the acetabulum. This is a deep socket to receive the head of the femur to form the hip joint. This is the hip bone of a young child. It is formed of three parts: the iliac part, the pubic part, and the ischial part. The iliac part, number 2, or ilium, forms the upper part of the bone. The pubic part, which is number 4, is also called the pubis and forms the anterior part of the bone. The ischial part, or ischium, forms the lower and posterior part of the bone. The three parts of the hip bone meet each other at cartilaginous junctions. These cartilaginous junctions form Y shape at the acetabulum, and this cartilage disappears in the adult, so that the three parts will form a complete hip bone. Next slide. This is the adult left hip bone. It is a complete bone. The upper part is the ilium or iliac part. The anterior part is the pubic part. The lower and the posterior part is the ischial part. Now let us describe the features of the iliac part. Number 1 is the iliac crest, which is the upper border of the iliac part. Number 2 is the anterior superior iliac spine. This is the anterior end of the iliac crest, and its posterior end is called posterior superior iliac spine. It is number 16. So number 2 is the anterior superior iliac spine. Number 16 is the posterior superior iliac spine. Now the anterior border of the iliac part extends from number 2 to number 4. Number 2 is the anterior superior iliac spine. Number 4 is the anterior inferior iliac spine. Now the surface of the iliac part shows three lines. The most posterior, number 15, is called the posterior gluteal line. The middle one, which is number 14, is the anterior gluteal line. The most anterior one is called the inferior gluteal line, which is number 3. So we have 3 lines: posterior, anterior, and inferior. And they are called gluteal lines because they are directed towards the gluteal region. Now let us move to the anterior part of the hip bone, which is the pubic bone. Number 7 is the superior ramus of the pubic bone, because the pubic bone has 2 rami, superior and inferior, and a body. Number 7 is the superior. Number 11 is the inferior pubic ramus, but number 10 is the body of the pubis. Number 9 is the pubic crest, which is the upper border of the pubic bone. And number 8 is a small elevation called the pubic tubercle. The pubic tubercle is the lateral end of the pubic crest. The pubic crest is the upper border of the pubic bone, like the iliac crest, which is the upper border of the iliac bone. Now, number 12 is called the obturator foramen, because in the living it is closed by a membrane called the obturator membrane. Let us move now to the ischial part, and the number 21 is the large part of the bone is called ischial tuberosity. Number 13 is the ramus of the ischium. So the ischium has an ischial tuberosity and a ramus. And number 19 is a spine related to the ischium called ischial spine. Below this ischial spine there is a small notch, number 20, called lesser sciatic foramen. And above the spine there is number 18, a greater sciatic foramen. So we have a greater sciatic notch and a smaller sciatic notch. These 2 notches are transformed by a ligament in the living to become foramina. So we have a greater sciatic foramen above the spine and a lesser sciatic foramina below the spine. But in the dry bone they are notches, greater sciatic notch and a lesser sciatic notch. Number 17 is the inferior posterior iliac spine. And the border between 16 and 17 is the posterior border of the iliac bone. Next slide. This is the left femur. It is a long bone, and any long bone has a shaft and 2 ends. The shaft here is number 5. It is a long cylindrical part. The upper end of the femur here shows the head, number 1, the neck, number 2, and 2 rough elevations for muscle attachments called greater and lesser trochanters. Number 9 is the greater trochanter. Number 4 is the lesser trochanter. The head of the femur, number 8, shows a depression. Number 1 is called fovea for the attachment of a ligament for the head. The neck of the femur, number 2, is an oblique segment which forms an angle with the shaft about 125 degrees. The greater and the lesser trochanters are connected together by a rough line called intertrochanteric line. Number 3, for the attachment mainly for a ligament of the hip joint called iliofemoral ligament. This is the upper end, which is formed of the head, neck, and the two trochanters. At the lower end shows two condyles, medial condyle number 7 and the lateral condyle number 10. Above the medial condyle there is a small elevation number 6 called adductor tubercle for muscle attachment. In front of the lower end there is an articular surface number 12 for articulation with the surface of the patella. Next slide. This is the left femur, posterior aspect. It shows the posterior border, which is number 6, instead of a surface. This border is called linea aspera, means strong ridge. This linea aspera divides in the upper fourth of the shaft into two limbs. The medial one, number 14, is called the spiral line, while the lateral limb, number 5, is called gluteal tuberosity. The same in the lower part. It divides into a medial supracondylar line, number 16, and a lateral supracondylar line, number 7. And in between the two lines there is a surface, triangular in shape, called popliteal surface, because it is related to the popliteal fossa, which is the fossa behind the knee joint. Let us go to the upper end, and here we can see number 1 and 10 is the head of the femur, number 11 is the neck, number 3 is the greater trochanter, and on its medial side there is a deep fossa, number 2, for the attachment of a muscle called obturator externus. And number 13 is the lesser trochanter, and it is connected with the greater trochanter by an elevated ridge called intertrochanteric crest, as compared with the intertrochanteric line on the anterior aspect, which is a line, but here it is a crest. Below at the lower end, we see the two condyles separated from each other by a deep depression, number 19, called intercondylar area or notch. The medial condyle shows a slight elevation, number 18, called the medial epicondyle, and the lateral condyle shows also a slight elevation, number 9, called the lateral epicondyle. Number 17 represents the adductor tubercle for muscle attachment. This diagram shows the double sources of the blood supply to the head of the femur. The source A gets the blood along the round ligament of the head of the femur, which is attached to the fovea of the head, and this ligament lies inside the hip joint. the source B is more abundant and comes from certain arteries and pass along the neck and enter the head and anastomose with the arteries coming from source A. Sometimes, in cases of fractured neck of the femur, the source B will be cut and the blood supply to the head will be insufficient, and the result will be necrosis of the head of the femur. This diagram shows abnormal neck of the femur that may occur in cases of fractures or diseases like rickets or something like that. In number A, we find the angle is more than 125 degrees, and this is called coxa valga. And the number B shows the angle is very acute and less than 125 degrees and called coxa vara. Coxa means hip. So far we finished the hip bone and the femur, which are the bones of the thigh. Now we start with the anatomy of the front of the thigh. This diagram shows a longitudinal section in the skin and the fascia of the front of the thigh and its continuation with those of the anterior abdominal wall. The junction between the two regions is marked by an arrow which represents the inguinal region or inguinal ligament. In this diagram, number 3 represents the skin. Number 2 represents the superficial fascia. And this superficial fascia is formed of 2 layers. A superficial fatty layer, which is number 2, and a deep membranous layer, deeper to it, represented in the diagram by a line. Deep to the membranous layer, there is a space. Number 1, the space lies in the anterior abdominal wall, deep to the membranous layer. And in the front of the thigh, number 7 represents the space in the front of the thigh, deep to the membranous layer. Between the membranous layer and the deep fascia of the thigh, which is number 6. Note that the membranous layer is fused with the deep fascia at a point number 5. So this fusion interrupts the space deep to the membranous layer between the abdominal wall and the front of the thigh. And this is of importance in cases of collection of fluid in the space number A in the abdominal wall, as in case of rupture urethra, where urine collects in this space, the space number 1 in the abdominal wall. And by gravity, this urine tries to go down, but it will stop at the point number 5. where the membranous layer is fused with the fascia lata of the front of the thigh. It will stop here. This is an important clinically in cases of ruptured urethra. Number 4 in the diagram represents the most superficial muscle of the anterior abdominal wall, which is called external oblique muscle, and the arrow just below number 4 represents what's called the inguinal ligament, which is the lower border of this muscle, aponeurosis. This diagram shows the arrangement of the fascia lata or deep fascia of the thigh. Lata means wide and extensive. This deep fascia surrounds the whole thigh and it gives strength for the muscular contraction deeper. And this deep fascia or fascia lata shows a perforation at its upper medial part, number 2, and this is called saphenous opening because it transmits the great saphenous vein, and therefore this saphenous opening, which is a perforation in the fascia lata, will be covered only by superficial fascia. And due to perforations of this superficial fascia by blood vessels and lymph vessels passing through to enter the saphenous opening, so it is called cribriform fascia. So the cribriform fascia covers the saphenous opening, number 2. Number 1 and number 4 and number 5 and number 6 represents the circular arrangement of the fascia lata around the thighs, like a stocking. Strong muscles in general requires a strong deep fascia so that the contraction will be powerful, and this is always present in the lower limb as a whole. We find it in the thigh and we find it in the leg. In addition to the strength of the deep fascia in the thigh, there is a longitudinal thickening on the lateral side in this deep fascia called iliotibial tract, gives more strength to the deep fascia. The thigh, as we see here, will be divided into 3 compartments. An anterior compartment which contains the extensors of the knee and the nerve which is called femoral nerve. Another compartment on the medial side contains adductor group of muscles and their nerve, which is called obturator nerve. And the third compartment is on the back, and it is called posterior compartment, which contains the flexor muscles of the knee and their nerve, which is called sciatic nerve. These 3 compartments are separated from each other by strong septa that arise from the fascia lata and pass inside the thigh to reach the bone of the femur. These septa also gives tight compartments for the muscles, so to allow them to contract very strongly, as I mentioned before. This is a transverse section or cross section in the thigh to show the compartments and the septa of the thigh. Number one is the anterior compartment, which contains the extensors of the knee and the femoral nerve. Number two is the medial compartment, which contains the adductor group and the obturator nerve. Number three is the posterior compartment, which contains the flexor group of the knee and the sciatic nerve. Number 7 is a lateral intermuscular septum. Number 5 is a posterior intermuscular septum. And number 4 is a medial intermuscular septum. These septa, which are responsible for division of the thigh into the compartments. Number 6 is a cut section into the shaft of the femur. This is a iliotibial tract, number 3. It is a thickened longitudinal band on the lateral side of the thigh. It extends from the iliac crest above, number 1, down to the lateral condyle of the tibia, which is the largest bone of the leg. This iliotibial tract receives the insertion of two muscles above, the tensor fascia lata in front and part of the gluteus maximus, number 5, behind. By contraction of these two muscles, the iliotibial tract becomes tense and lead to the stable erect posture by extending the hip joint and the knee joint. This diagram shows the structures passing through the saphenous opening of the fascia lata. Number 7 is the margin of the saphenous opening. The structures in the diagram passing through the saphenous opening are vessels, arteries and veins. And of course, they will perforate the roof of the saphenous opening, which is formed by the cribriform fascia. These veins join the great saphenous vein, number 6, and they do not pass through the saphenous opening. What enters the saphenous opening of the veins is the great saphenous vein, and this is not the case with the arteries, because the accompanying arteries pass through the saphenous opening. So the vessels here are 3 groups. A group passing upward and laterally below the inguinal ligament, number 10. These are the superficial circumflex iliac vessels, number 8 and number 9. They are called superficial because they lie in the superficial fascia. And circumflex because they will curve around the anterior superior iliac spine of the iliac crest. So it's called superficial circumflex iliac. Circumflex from circumference. And as you see in the diagram, they pass below and parallel to the inguinal ligament. This inguinal ligament extends from the anterior superior iliac spine laterally to the pubic tubercle medially. It is part of the external oblique muscle of the abdomen. It is the lower border of its aponeurosis. And it marks the line of junction between the anterior abdominal wall and the front of the thigh, this inguinal ligament. The second group of vessels is the superficial epigastric vessels, which pass upward, straight upward, to cross over the inguinal ligament to enter the abdominal wall. The third group passes medially to cross over the spermatic cord, number 5. This medial group, number 3 and number 4, so called the superficial external pudendal, because they are superficial to the spermatic cord. Superficial external pudendal. And they are called external because there is another vessel called internal. They come from inside the pelvis. So these are called external because they are outside the pelvis. They are in the front of the thigh. They pass superficial to the spermatic cord. There are vessels deep to the spermatic cord called deep external pudendal, but these are superficial. Number 1 and 2 are the superficial epigastric vessels. So again, the great saphenous vein is the only vein that passes through the saphenous opening, but its tributaries, which are the superficial circumflex iliac, superficial epigastric, and superficial external pudendal veins, do not pass through the saphenous opening, but they end in the great saphenous vein before it enters the saphenous opening. But the arteries, the superficial circumflex iliac, the superficial epigastric, and the superficial external pudendal arteries, they arise from the femoral artery deep to the fascia lata and pierce and traverse and pass through the saphenous opening. This diagram shows the femoral triangle position and boundaries. The femoral triangle is a muscular triangle. It lies in the upper third of the front of the thigh, just below the inguinal ligament, number 1. Its boundaries are medially, number 2, is the medial border of a muscle called adductor longus. The lateral boundary, number 6, is formed by the medial border of the sartorius muscle. So the two borders are medial. Medial border of adductor longus and the medial border of sartorius muscle. These two side borders meet below at the apex of the triangle, number 3, where the triangle continues with a canal in the middle of the medial side of the thigh called adductor canal or subsartorial canal or Hunter's canal. It is in the middle third of the medial side. So the upper third of the thigh front is formed by the femoral triangle. The middle third of the thigh has the adductor canal on its medial side, but its lower third has nothing except muscles. The base of the femoral triangle is formed by the inguinal ligament, number 1, which extends from the anterior superior iliac spine to the pubic tubercle medially. This triangle has a roof of skin and fascia, has a floor formed by muscles, and has contents of vessels and nerve, femoral sheath, and the femoral canal. This is the floor of the femoral triangle. The muscles in the floor of the posterior triangle are the following: from lateral to medial. The most lateral, which is number 2, is the iliopsoas muscle. The next one medially, number 3, is the pectineus muscle. Then the most medial muscle, number 4, is the adductor longus muscle. Number 5 represents the medial border of the sartorius muscle. Number 1 represents the inguinal ligament. The iliopsoas muscle, which is number 2, is a large muscle that arises inside the abdominal cavity and pelvis. It's formed of 2 parts. The psoas major muscle arises from the sides of all lumbar vertebrae in the abdominal cavity, while the other part, which is called the iliacus muscle, arises from the iliac fossa in the medial side of the iliac bone in the pelvis. The 2 fleshy parts, psoas major and iliacus, fuse together deep to the inguinal ligament to form a single muscle, and thus they are found together in the floor of the femoral triangle in its lateral part. This muscle is inserted into the lesser trochanter, and it is the main flexor of the hip joint because it is a strong, powerful muscle. The pectineus muscle, number 3, arises from the pectineal surface of the superior ramus of the pubis and is inserted into the upper part of the shaft of the femur in what is called the spiral line. This muscle is a flexor of the hip and also adductor, and so it has a double nerve supply. The adductor longus, number 4 in the diagram, is the most medial muscle of the floor of the triangle, and it is the most superficial muscle in the adductor group, because deeper to this muscle is the adductor brevis and adductor magnus. But the muscle which lies in the femoral triangle is the longus, the adductor longus muscle. This diagram shows the contents of the femoral triangle. Number 1 is the femoral nerve, which is the most lateral structure. Just medial to the femoral nerve lies the femoral artery, number 2. This femoral artery is a continuation of the external iliac artery, which comes from the pelvis. The femoral artery enters the femoral triangle just behind the inguinal ligament at what is called the mid-inguinal point. This mid-inguinal point lies midway between the anterior superior iliac spine and the pubic symphysis. Medial to the femoral artery lies the femoral vein. The upper 3 centimeters of the femoral artery and the femoral vein are surrounded by a fascial sheath called femoral sheath, number 4. The sheath is formed of 2 layers called fascia transversalis in front of the vessels and the fascia iliaca behind the vessels, and the 2 fasciae fuse together at the end of the sheath, 3 centimeters below the inguinal ligament, as I mentioned before. These 2 layers of fascia come from the pelvis. The fascia transversalis lines the transversus abdominis muscle, which is a muscle of the anterior abdominal wall, while the fascia iliaca covers the iliacus muscle, which lies in the pelvis. Here, on the medial side of the femoral vein lies deep inguinal lymph nodes, number 5, and they lie on the pectineus muscle. Pectineus muscle, it is a muscle of the floor of the femoral triangle. So, the femoral nerve lies lateral to the vessels and outside the femoral sheath, while the femoral vessels, artery and vein are surrounded in its upper part by the femoral sheath. But there is a point to be completed as regarding the femoral sheath, that within the femoral sheath and medial to the femoral vein there is a canal called the femoral canal, and this femoral canal is closed below by the fusion of the layers of the femoral sheath, but it is open upward into the abdominal cavity, and this femoral canal is a pathway for the femoral hernia, which will be described later. These are the contents of the femoral sheath as appearing in a transverse section. Number 7 is the femoral nerve outside the sheath and deep to the layer of the femoral sheath called the fascia iliaca, number 10. The femoral artery, number 5, together with a fine nerve, small nerve, number 6, called the femoral branch of the genitofemoral nerve, both together lie in the lateral compartment of the femoral sheath, because the femoral sheath is divided into 3 compartments by 2 septa. The lateral compartment contains the femoral artery and the femoral branch of the genitofemoral nerve, number 5 and 6. The intermediate compartment, number 11, contains only the femoral vein. And number 4 represents the fascia transversalis, which is the anterior wall of the femoral sheath. Number 3 is the most medial compartment of the femoral sheath. This is the femoral canal. It is an empty canal except of some lymph nodes, one lymph node, and some lymphatic vessels. It is a pathway for the femoral hernia. It lies lateral to a ligament called the lacunar ligament, number 2. Note the muscles deep to the femoral sheath. The pectineus muscle, number 1, and the iliopsoas muscle, number 9. So, look at the inguinal ligament, number 8. It is superficial to the femoral sheath. So the femoral sheath with its 2 layers, the fascia transversalis, number 4, and the fascia iliaca, number 10, and its 3 compartments lie deep to the inguinal ligament. The femoral nerve is outside the femoral sheath. This diagram shows the structures in the roof of the femoral triangle, that is to say, in the superficial fascia. These structures are superficial vessels, cutaneous nerves, and superficial inguinal lymph nodes. Number 2 shows the superficial inguinal lymph nodes, which lie as a chain just below and parallel to the inguinal ligament. Number 5 is the ilioinguinal nerve coming out of the inguinal canal, and number 3 is the femoral branch of the genitofemoral nerve, which lies in the lateral compartment of the femoral sheath. These 2 nerves arise from the first lumbar nerve and supply the skin of the upper part of the femoral triangle, about hand breadth, just below the inguinal ligament. Number 7 is the great saphenous vein, which lies vertically and ascends on the medial side of the femoral triangle to enter the saphenous opening to end in the femoral vein. This diagram shows the cutaneous nerves of the front of the thigh, which means the nerves supplying its skin. These nerves arise from different sources. Most of them arise as branches from the femoral nerve, number 8. This femoral nerve gives the intermediate cutaneous nerve of the thigh, number 5, and the medial cutaneous nerve of the thigh, number 4. In addition to these branches of the femoral nerve, there are other nerves. For example, the lateral cutaneous nerve of the thigh, which is number 9. This nerve does not arise from the femoral nerve, but arises directly from the lumbar plexus in the abdominal cavity. The other nerves are, number 1, this is a femoral branch of the genitofemoral nerve, and number 2 is the superficial inguinal opening transmitting the ilioinguinal nerve, number 3. Number 6 is a cutaneous branch from the obturator nerve, and number 7 is a nerve called infrapatellar branch of the saphenous nerve. Infrapatellar means below the patella. From the saphenous nerve, this nerve is also a branch from the femoral nerve. Back again to the femoral sheath to describe in more detail the femoral canal. As you know now, the femoral sheath is formed of 2 layers: an anterior layer formed by the transversalis fascia, and a posterior layer formed by the fascia iliaca, and the space between the 2 layers is divided into 3 compartments by 2 septa. The lateral compartment is occupied by the femoral artery and the femoral branch of the genitofemoral nerve. The intermediate compartment lodges the femoral vein, while the medial compartment is the femoral canal. Here, number 5 shows the femoral nerve outside the femoral sheath. Number 4 shows the femoral branch of the genitofemoral nerve in the lateral compartment, just lateral to the femoral artery. Number 3 is the femoral artery in the lateral compartment. Number 2 is the femoral vein in the intermediate compartment. Number 1 is the femoral canal, which is the medial compartment and shows a single lymph node in its cavity. This picture shows the relations of the femoral canal, because the importance of this canal is that it is the route for the passage of a femoral hernia from the abdominal cavity to the front of the thigh. So its relations are important surgically. Number 3 is the cut section of the femoral canal with the inguinal lymph node, a single node, one of the deep. inguinal nodes is present in its cavity. Just lateral to the femoral canal is the femoral vein, number 4. And just medial to the femoral canal is the curved edge of a ligament called the lacunar ligament, which is number 1. And these two relations are of importance from the surgical point of view, because an injury to the femoral vein may lead to severe hemorrhage. And the medial relation, which is the edge of the lacunar ligament, number 1, may have an abnormal artery in this free edge, number 2. This abnormal artery is not present in all people, but may present only in 30% of people, and also may be a source of risk during surgical operation, when the surgeon may cut the free edge of the lacunar ligament to widen the space. So these medial and lateral relations of the femoral canal are important. Other relations are: in front is the inguinal ligament, and behind or posterior is the pectineus muscle, number 6. So these are the main relations of the femoral canal. This picture shows the course of the femoral hernia when it descends through the femoral canal. Any hernia from the abdominal cavity has a sac. This sac of the hernia is part of the parietal peritoneum, and as this sac is protruded through the femoral canal, it gets coverings, and sometimes this sac becomes filled with a loop or convolution of the small intestine called content of the hernia. So any hernia consists of a sac of peritoneum and has coverings and contains intestine, usually small intestine, and as it descends it has a special course. The femoral canal here shows the femoral hernia inside descending downward from the abdominal cavity, and then at the end of the femoral canal the hernia found itself in the saphenous opening. So it emerges from the saphenous opening because it is the weakest point in the fascia lata, and ascends upward and laterally just below the inguinal ligament. This is the course of the femoral hernia, U-shape, at first downward in the femoral canal, then upward and laterally from the saphenous opening. We see now, number 1, this is the beginning of the femoral hernia, which is a part of the parietal peritoneum of the abdomen. Number 2 is the lacunar ligament, which is a medial relation of the femoral canal. Number 3 is the femoral canal itself, with the hernia descending through it as a tube. Number 4 is the margin of the saphenous opening through which the hernial sac protruded upward and laterally as the arrow shows. Number 7 is the sac of the femoral hernia. Number 5 is the femoral vein just lateral to the beginning or neck of the femoral sac. Number 6 is the inguinal ligament. In case of reduction of this hernia, that's to say pushing it backward to enter the abdominal cavity, the direction of pushing will be at first downward and medially, then backward and then upward to enter the abdominal cavity. This picture shows mainly the muscular branches of the femoral nerve. But the femoral nerve gives also cutaneous branches, which we mentioned some of it before. The intermediate and the medial cutaneous nerves of the thigh and the saphenous nerve. These are its cutaneous branches. But now we are concerned mainly with the muscular branches to the muscles of the front of the thigh. We see here the femoral nerve number 2. This is the trunk of the femoral nerve appearing in the pelvis between the psoas major and the iliacus, because the femoral nerve arises in the abdominal cavity from the lumbar plexus, from the roots lumbar 2, 3 and 4, and then descends in the pelvis and emerges between the iliacus muscle and psoas major muscle before they fuse together. And here, as it emerges from the gap between the two muscles, it supplies the iliacus number 1, noting that the psoas major itself is not supplied from the femoral nerve, but it is supplied by several branches from the lumbar plexus higher up in the abdominal cavity, not from the femoral nerve. So the only branch muscular of the femoral nerve that arises above the inguinal ligament while it is in the pelvis, it is the branch to the iliacus, is number 1 in the diagram. As it comes out from under cover of the inguinal ligament, it divides almost immediately into its branches, cutaneous and muscular. The femoral nerve has a long course inside the pelvis, but a very short course in the front of the thigh, not more than 1 or 2 centimeters. Then it will end by dividing into terminal branches. The diagram shows branches in the front of the thigh. Most of them are muscular, but one is apparent in the diagram number 6, is an articular branch to the hip joint. It is a sensory branch, but there are other branches to the muscles. For example, here number 3 is a pectineus muscle, gets a branch from the femoral nerve. And then number 4 is a branch from the femoral nerve that enters into the adductor canal to supply the vastus medialis muscle. The adductor canal here is number 5. The vastus medialis is a part of a big muscle with 4 heads called quadriceps femoris. The vastus medialis is the medial part Vastus means wide. Number 9 are two branches to the intermediate part of the quadriceps muscle. It is called vastus intermedius. The two nerves enter its anterior surface. Number 10 is a branch to the vastus lateralis of the muscle, the lateral wide part of the quadriceps muscle. So now the three vasti, each vastus receives its own nerve supply from the femoral nerve. Then number 8 is the sartorius muscle. It gets a special branch for it. Number 7, here, this is the which muscle? Oh, number 7 is the rectus femoris, the fourth head of the quadriceps. Also has a separate nerve supply. So the quadriceps, which we shall come to it later to describe in more detail, has 4 heads. Each head has its own nerve supply. These are the muscular branches of the femoral nerve. This picture shows the course of the femoral artery. The femoral artery, number 2, is a continuation of the external iliac artery. And the external iliac artery is a branch from the common iliac artery. And the common iliac artery is a terminal branch of the abdominal aorta. Now, we see the femoral artery enters the femoral triangle just beneath the inguinal ligament at the mid-inguinal point. And its uppermost part, which is number 1, is within the femoral sheath. So number 1 represents the femoral sheath, which lies in the femoral triangle. Number 2 is a part of the femoral artery in the femoral triangle, which means this is in the upper third of the front of the thigh. Then at the apex of the femoral triangle, where it is continuous with the adductor canal, the femoral artery with the number 3 lies in the adductor canal. At the end, lower end of the adductor canal, the femoral artery leaves the front of the thigh, number 4, and enters the popliteal fossa on the back of the lower end of the femur. So at the lower end of the adductor canal, the femoral artery changes its direction and its name. It leaves the medial side of the thigh and pierces the adductor magnus, where there is an opening inside the magnus muscle, where the artery passes through it to enter the popliteal fossa, where it is called the popliteal artery. This is the course of the femoral artery. Posterior relations of the femoral artery. In the vertical course of the femoral artery, from the mid-inguinal point to the perforation in the adductor magnus, the femoral artery descends in front of the following muscles from above downward. The first muscle is the iliopsoas muscle, which is number 2 in the diagram. Then the pectineus muscle, number 3. then the adductor longus muscle, number 4, and finally the adductor magnus, number 5. At the perforation in the adductor magnus, which is number 6, the artery passes to the popliteal fossa, where it becomes the popliteal artery. This diagram shows the relations of the femoral vein to the femoral artery. The femoral vein, which is number 2 in the diagram, at first it lies on the medial side of the femoral artery in the femoral triangle, but as it descends downward, it comes to lie posterior, then posterolateral to the femoral artery, which is number 4. Number 1 shows the femoral canal medial to the femoral vein, and number 3 shows the apex of the femoral triangle, where it becomes continuous with the adductor canal. So in the adductor canal, the femoral vein is posterolateral to the femoral artery, and it remains like this until it enters the popliteal fossa and become the popliteal vessels. This diagram shows the surface anatomy of the femoral artery, which means to draw a line on the skin corresponding to the artery. This line starts above at the mid-inguinal point, which is number 2. This point lies midway between the anterior superior iliac spine and the symphysis pubis. From this line, we draw a vertical line down to the adductor tubercle, which is number 4 in the diagram. The artery, the femoral artery, corresponds to the upper 2/3 of this line, from number 2 to number 3, because at number 3 the artery disappears to enter the popliteal fossa. This diagram shows the branches of the femoral artery. As you see, the femoral artery descends from the inguinal ligament above to the perforation in the adductor magnus below. And this artery gives off branches. Some of them are superficial and some are deep. Let us begin with the superficial branches, which are called superficial inguinal branches or superficial inguinal arteries. They arise very close to the inguinal ligament, and they are 3. Number 8 represents the superficial circumflex iliac artery, which passes laterally just below the inguinal ligament to reach the anterior superior iliac spine. Number 1 is the superficial epigastric, which ascends into the superficial fascia of the lower part of the anterior abdominal wall. Number 3 is the superficial external pudendal artery, which passes medially superficial to the spermatic cord. Number 4. The word pudendal means genital organs. The spermatic cord, which is number 4, is coming out from the superficial inguinal ring, which is a ring in the muscle of the anterior abdominal wall. Deep branches of the femoral artery are the deep external pudendal number 2, which is the highest branch very close to the inguinal ligament and runs medially deep to the spermatic cord. This deep external pudendal number 2 and the superficial external pudendal number 3 pass medially around the spermatic cord. Then we move a little bit downward to find the profunda femoral artery, profunda femoris, which is number 5. It arises from the back of the femoral artery about 4 centimeters below the inguinal ligament. That is to say, just below the end of the femoral sheath. This profunda femoris passes medially deep to the femoral artery to enter the medial side of the thigh where the adductor muscles lie. And the word profunda means deep. The lower end of the femoral artery, just above the perforation into the adductor magnus, we find the descending genicular artery, number 10. This artery descends to the knee joint. That's why it is called genicular. Genu means knee. And this descending genicular artery gives a small branch called the saphenous artery, which is number 7. Now let us look at number 6, which is the saphenous nerve. This is the longest cutaneous branch of the femoral nerve. In the femoral triangle, it lies lateral to the femoral artery, but gradually it crosses over the artery to come medial to it in the adductor canal. This diagram shows the profunda femoris artery and its branches. This profunda femoris is the largest deep branch of the femoral artery, which arises from the posterolateral part of the femoral artery, number 11, about 4 centimeters below the inguinal ligament. This profunda artery passes downward and medially among the adductor muscles, which lie on the medial side of the thigh, and it ends below as what's called the fourth perforating artery, which is one of its branches, number 8. This fourth perforating artery, as we see, perforates the adductor magnus, number 9, to reach the back of the thigh and shares in an anastomosis there. Now we go to the highest branches of the profunda femoris artery, and these are 2 circumflex branches, one lateral and one medial. The lateral circumflex femoral artery, number 14, passes laterally and then divides into 3 branches. One is ascending, number 12. It ascends to the anterior superior iliac spine and shares in the anastomosis there. The second is number 13, is a transverse branch and it curves around the femur from the lateral side and shares in the cruciate anastomosis, which is present on the upper part of the back of the thigh, and cruciate means cross-like. The third branch of the lateral circumflex femoral, which is number 15, descends vertically for a long distance to reach the anastomosis around the knee and shares in it. The second circumflex femoral artery, which is the medial circumflex, number 2, passes medially, and that's why it's called the medial circumflex femoral, because it will curve around the medial side of the femur. As we see in the diagram, this artery disappears from the femoral triangle by passing between two muscles of the floor of this triangle, the iliopsoas muscle number 10 and the pectineus number 1. As it reaches the back of the thigh, it shares in the anastomosis there. The other branches of the profunda femoris are called perforating arteries or perforators. They are 4. The first perforator is number 4. It passes between the pectineus muscle and the adductor brevis. The second perforator pierces the adductor brevis. The third perforator, number 7, arises between the adductor longus and the adductor magnus, because here the profunda femoris lies between the two muscles, the adductor longus in front and the adductor magnus behind. The fourth perforator, as I mentioned before, which is number 8, is the termination, the terminal part of the profunda femoris. It pierces the adductor magnus to reach the back of the thigh, and there the 4 perforators join each other, forming a longitudinal chain of anastomosis. As regards the relations of the profunda femoris to muscles, as we see in the picture, the artery above descends at first in front of the pectineus muscle, then in front of the adductor brevis muscle, then between the adductor longus and adductor magnus, and at this site the adductor longus separates the profunda femoris behind from the femoral artery itself in front, because at this site, which is the adductor canal, the femoral artery descends in front of the adductor longus insertion. So the adductor longus separates the femoral artery in front from the profunda femoris behind. And a cut injury here, as a stab wound, for example, at this site, will cut the two arteries together, leading to severe hemorrhage. At the end of the artery, which is the 4th perforator, number 8, as I mentioned before, it will pass backward through the adductor magnus. This is a longitudinal chain of anastomosis which lies on the back of the thighs. superficial to the adductor magnus. Let us begin from the highest branch, which is number 1. It is the inferior gluteal artery. This inferior gluteal artery, called gluteal because it lies in the gluteal region, is a branch from the internal iliac artery, which lies in the pelvic cavity. And this inferior gluteal artery descends, as we see, to join an ascending branch, number 2, which is the ascending branch of the medial circumflex femoral artery, number 6. As I mentioned in the previous slide, the medial circumflex femoral passes backwards to the back of the thigh, and here it is in the back of the thigh, and we see that it gives off an ascending branch number 2, which joins the inferior gluteal, as I mentioned, and a transverse branch that joins the transverse branch of the lateral circumflex femoral, number 3. So they form a circle around the upper part of the femur, and that's why they are called circumflex femoral. This circle joins an ascending branch from the first perforating artery, number 7. So the ascending branch of the first perforating, which joins the circle from below, and the ascending branch of the medial circumflex, which joins the circle from above, they form together what is called cruciate anastomosis, because it looks like a cross. So the cross here, or the cruciate anastomosis, is formed of a horizontal limb formed by the transverse branches of the medial circumflex, number 6, and the lateral circumflex, number 3, and a vertical limb formed by number 2 and an ascending branch from number 7. Number 2 is the ascending branch of the medial circumflex, and the number 7 gives an ascending branch to join the anastomosis. This is the cruciate anastomosis, which is an important anastomosis clinically in cases of obstruction or ligation of the femoral artery. We go down and we can see the 4 perforating arteries joining each other, forming the longitudinal chain of anastomosis, number 4. And below the last perforating artery gives a branch which descends down to join an ascending branch from the popliteal artery. This ascending branch is number 5, and the popliteal artery is number 8. The popliteal artery, as you see, is the continuation of the femoral artery, and we can see how it perforates the adductor magnus to become continuous with the femoral artery and reaches the back of the lower end of the femur, which is called the popliteal surface, and therefore it is called the popliteal artery. So as we see, this longitudinal chain of anastomosis connects the popliteal artery below and the femoral artery above through the perforating branches and the circumflex branches, and also the internal iliac artery inside the pelvis. So it is a very long anastomosis and very important in collateral circulation in cases of ligation of the big arteries in the pelvis or in the thigh. This diagram shows the muscles of the front of the thigh. We start by the sartorius muscle, which is a long, slender muscle which arises from the anterior superior iliac spine above and has two courses: an oblique course where it forms the lateral boundary of the femoral triangle, and a vertical course below, number 9, where it forms the roof of the adductor canal. So the muscle passes in two regions: the region of the femoral triangle above and the region of the adductor canal below. This muscle is inserted into the upper medial aspect of the tibia. The upper part of the medial surface of the tibia, together with other two muscles, which are the gracilis and semitendinosus, which we shall describe later. So as we see, this sartorius muscle separates the muscles in the floor of the femoral triangle, number 5, number 6, and number 7, from the heads of the quadriceps femoris muscle, number 2, number 3, and number 10. Again, the upper part of the sartorius separates the three muscles in the floor of the femoral triangle, which are the iliopsoas muscle, number 5, the pectineus muscle, number 6, and adductor longus muscle, number 7. These are the muscles of the floor of the femoral triangle, as you know. But number 8, it is not a muscle in the floor of the femoral triangle. It is the gracilis muscle. It is one of the adductor muscles, and it belongs to the medial side of the thigh, but it is drawn here. But the three muscles of the floor of the triangle are number 5, 6, and 7. Lateral to the sartorius, so the oblique part of the sartorius, are the three heads of the quadriceps femoris. Number 2 is a head of the muscle called rectus femoris, because it is a straight head passing in a straight course from above downward. And this rectus head overlies or lies over another head of the quadriceps, which is not shown in the diagram because it is covered by this rectus. And this hidden head is called the vastus intermedius, because the quadriceps femoris has 4 heads: 1 rectus femoris and 3 vasti. Vastus means wide and extensive. The vastus intermedius is in the middle part of the area, hidden by the rectus femoris. But the vastus lateralis, number 3, it is apparent here, lies on the lateral side, and the vastus medialis, number 10, lies on the medial side. The 4 heads of the quadriceps femoris join together to form a single insertion, to be inserted into the patella, this black area. And from the patella, there is a ligament reaching the anterior tubercle of the tibia called the ligamentum patelli. So, this is the region of the quadriceps muscle, the muscle of 4 heads. Quadri means 4, ceps يعني heads. If we go up towards the iliac crest, we find the origin of the sartorius, and on its lateral side the muscle called the tensor fascia lata. This tensor fascia lata forms with the sartorius an inverted V, and this tensor fascia lata is attached below to the iliotibial tract number 4. It is a long, thick band of deep fascia acting as a tendon for the tensor fascia lata. This iliotibial tract is attached to the lateral condyle of the tibia. The tensor fascia lata, the name means that this muscle makes tension to the deep fascia of the thigh, represented by the iliotibial tract. So it is called the tensor fascia lata, means it makes tension to the deep fascia or the iliotibial tract. So again, we have 2 main groups in the front of the thigh. The group of the muscles on the floor of the femoral triangle, which is formed of the iliopsoas number 5, pectineus number 6, and adductor longus number 7. And this group is separated for the lateral group by the sartorius muscle, the oblique part of the sartorius muscle. And this lateral group is formed of the heads of the quadriceps femoris, mainly the 4 heads. 3 of these heads are visible, but the 4th head, which is the vastus intermedius, is hidden by the rectus femoris head. The quadriceps femoris heads are the rectus femoris and the 3 vasti: vastus lateralis, vastus intermedius, and the vastus medialis. And the 4 heads, which arise each head from a separate origin, join all of them into a single tendon of insertion to be inserted into the patella, and from the patella through the ligamentum patelli to the anterior tubercle of the tibia, and thus its action is extension of the knee joint. The quadriceps is the main extensor of the knee joint. This is the quadriceps femoris muscle in more detail. The 3 heads visible are the rectus femoris, number 5, the vastus lateralis, number 3, and the vastus medialis, number 6. But the fourth head, which is the vastus intermedius, is hidden under cover of the rectus femoris. The rectus femoris is shown to arise by two tendinous origins. Number one, above, is a straight head of origin. It arises from the anterior inferior iliac spine. Number two is another head of origin. It is called reflected head. It arises from a depression just above the acetabulum, and the two heads join together to form a single tendon of origin. Below, we can see that the three heads, the vastus lateralis, the rectus femoris, and the vastus medialis, and of course the vastus intermedius, which lies hidden under cover of the rectus femoris. All four heads are inserted below into the patella, number 8, and from the patella arises a strong ligament, number 9, called ligamentum patelli, or the patellar ligament, and this ligamentum patelli is attached to the anterior tubercle of the tibia, number 10. This is a cross section in the middle of the thigh. It shows in the middle of the diagram, number 7, is the cross section in the femur bone. And this cross section in the femur shows posteriorly the linea aspera, which is a prominent thick posterior border, and this linea aspera gives origin to 3 strong fibrous septa that divide the thigh into 3 compartments. Number 1 is the anterior compartment, which shows the muscles around the femur. Number 4 is the medial compartment, and the number 8 is the posterior compartment. So as we see in the section, the thigh is divided into 3 compartments. Actually, there are 3 muscular compartments. We are concerned now with the anterior compartment to show in more detail the 4 heads of the quadriceps femoris muscle and their relation to the femur. Let us begin with number 5. Number 5 is the vastus intermedius, and as you see, it is the deepest head, and it covers the front of the femur and its lateral side, but not its medial side. It arises from the front and the lateral side of the femur, but not from its medial side. So the medial side of the femur is bare, which means does not give origin to muscles. But the anterior surface and the lateral surface of the femur, as well as the posterior border, all these give origin or attachment to muscles. Superficial to the vastus intermedius, there is a rectus femoris, as we mentioned before, number 2. So number 2 is the rectus femoris in section. It lies between the borders of the vastus medialis, number 3, and the vastus lateralis, number 6. And therefore, when we look from the front of the thigh, we cannot see the vastus intermedius because the rectus femoris covers it. The vastus medialis, as we see, takes origin from the linea aspera, leaving the medial surface of the femur bare, as I mentioned before. So its origin is mainly here from the posterior border, from the linea aspera. And the same for the vastus lateralis. The vastus lateralis form most of the front and the lateral side of the anterior compartment. It covers most of the vastus intermedius, and it also arises from the linea aspera, not from the surfaces of the femur. The muscle head which arises from the surface of the head is the vastus intermedius.